Director of Surveillance at CARPHA, Dr. Joy St. John, says cancer cases in the region are on the rise and are affecting younger people. Cancer is the second leading cause of death in the region. Breast cancer is the main cause of death among females, followed by cervical cancer. Among males, the majority of cancer deaths are due to prostate and lung cancer. President of the Grenada Cancer Society, Dr. Barry Barnett, says the CARPHA report is a true reflection of what's happening locally.
Well, there's some cancers that are peculiar to young people. For example, acute lymphoblastic leukemia we see in children. But what we also notice that some cancers are appearing at an earlier age than previously. For example, we had cancer of the cervix in women in their 20s. Most cancers tend to be in an older age. We had a death from cancer of the cervix in somebody who was in their 20s. In breast cancer, we've had patients in their 30s with breast cancer. And in general, these cancers tend to occur at a much later stage in life. So there is an earlier appearance of cancers, we think, among some of our patients also.
A call has also been made for a Caribbean Cancer Registry hub, which will facilitate increased surveillance of cancers and provide data to provide support to cancer prevention and control, which will be launched this year. This, Mr. McMahon says, is direly needed.
About 3 years ago, we had a consultant from Trinidad who started the establishment of the Grenada Cancer Registry. It needs its own staff, data entry clerk and a surveillance nurse to make sure it goes on, to make sure that data is actively collected from doctors all over the country. People who travel gets included, and some of the analysis is done to give us figures which we can compare nationally and internationally to make sure that we know what's happening with cancer.
Tobacco use, unhealthy diets, physical inactivity, and harmful use of alcohol are common risk factors that contribute to the development of cancers. Research has shown that a reduction in risk factors in the population will contribute to a reduction in cancer cases and, as a consequence, deaths and related medical costs. Eugenia Peters, GBN News.